our 7th episode of Community Matters, Matters that Matter to You. I'm Mayor Mary Alexander-Basta, and today's topic is COVID-19, Phase 5 and beyond. As of Friday, June 11th, Governor Pritzker moved Illinois into Phase 5 and lifted restrictions on indoor and outdoor event capacity. While we're all excited to get back to life as normal or the new normal, there are still some precautions to take in order to stay safe. And I'm sure many of you have questions with regards to the guidelines and the lifted restrictions. Today, I'm honored to be joined by Director of Illinois Department of Public Health, Dr. Ngozi Ezike. Dr. Ezike has an impressive resume, including being a board-certified internist and pediatrician, and has held titles such as the Medical Director of the Austin Health Center, Medical Director of the Cook County Juvenile Detention Center, and Assistant Professor of Pediatrics at Rush Medical Center. After serving more than 15 years with Cook County Health, she joined IDPH. Many of you probably followed her updates along with that of the governor, so we are extremely honored to have her here with us today. Thank you so much for being here. We appreciate it.
Thanks for having me.
Also in the audience today, we have Dr. Kenneth Campbell, who is the Executive Assistant to the Director, Lori Sanders, Deputy Director of IDPH, and Olu Yenuron, Executive Assistant to the Director. We have, for the first time, we actually have a group of staff members that are in attendance as well as some visitors. So thank you all for being here. Remember, you can join the conversation on Facebook. If you'd like to ask questions, you can do so. And let's get it started. Tell us a little bit about yourself. Thank you again for being here. And we have some questions coming in. We'll go there.
Yeah, no, thank you so much for having me. Of course, I'm so humbled and honored to serve as the director of the Illinois Department of Public Health. I've been in this role now for 2.5 years. Obviously, when we talked about the role, when the governor was interviewing me, we didn't quite know what was in store for us. But we've been able to hang through it, through this all, and we're really excited to celebrate where we are. This is, the first Tuesday of Phase 5, so happy Phase 5 Tuesday. And so it doesn't mean exactly what we thought it would in terms of thinking that it would be over, but we are still in a much better place than we were 6 months ago, a year ago, and so want to make sure everybody's clear about that. So thank you for the invitation to talk a little bit about that.
Okay, so first question, and you alluded to it a little bit, is briefly describe what does Phase 5 look like today?
So as you already led with it, the main thing is that those capacity restrictions, we had many places where they were open only for 50% or 60% in the, quote, bridge phase. And so all of those capacity limits have gone away. So as I did notice this weekend, a lot of places are at 100% capacity, 150% capacity, and more. And so that is a big, big change. So the venues are fuller. We had, I think there was a Cubs game that was at full capacity. People can have their large scale, whatever number of guests at any wedding or private function. So again, the masks have not completely disappeared, but definitely the capacity limits have disappeared.
Well, that's great, and we've experienced some of what you mentioned right here in Bolingbrook. Our summer concerts are back. We had a carnival not too long ago. So yes, people are very anxious to get out, to say the least. So tell us a little bit, do you know what the vaccination rate is for Bolingbrook, and how are we doing compared to other municipalities?
No, that's a great question. So in general, we publish all that information on our website, by county. But I know for Bolingbrook specifically, we have about 33,000 individuals who are fully vaccinated. So I think that's about half of the population. Maybe a little bit, your population's about 70-something thousand?
Close to 77, yeah.
So a little, almost half, not quite half. I think for Illinois in general, I think we are over that 50% mark. So we have a little bit more to go Bolingbrook to keep up with the rest of the state. But, I know of some of the really exciting initiatives, including EMS going door to door for anyone who requests getting that vaccination. So it's not too late. It's actually just the right time to get vaccinated, because as there's so much gathering and activities, we want to make sure every single person is fully protected and doesn't succumb or get ill or even have these long haul symptoms that we keep hearing about, even in people who have such mild infections.
We have been, our EMS staff, we've held numerous vaccination clinics right here in the village. We actually, I think we're one of the first to host the Pfizer 12 and older vaccine. So we had great outcome with that. And we will definitely continue to push it. Our EMS staff, actually Edgar is here. He's been one of the spearheads of the campaign. Say hello. Thank you again. So we know that the Pfizer is out for 12 years and older. Are there any other vaccines that are seeking approval for younger age groups, and what does that look like, and when do we think that might be in effect?
Yeah, so I don't have exact dates, but we do know that Moderna has already submitted their information to get the approval for 12, to go down to 12. And so we think that a decision might be made sometime in the near future, sometime this summer, to talk about having Moderna go down to 12. And then we know that the trials are ongoing right now for 6 months to 2 years, 2 to 5, and then 5 to 11. So those trials are happening for both Pfizer and Moderna, and we hope that we will have some more information in the fall about even lower ages. So a lot of new things on the horizon, nothing set in stone, but we think that there will be more people who will be eligible to get the vaccine in short order.
Great. So with keeping that in mind, what should be done as it relates to masks for those that have younger age kids or around younger age kids that are therefore not vaccinated?
That's a really important consideration, and so a really important issue. So again, first of all, planes, trains, buses, like there are places where masks are still required. Healthcare settings, congregate settings, masks are still required in those places. So you can't get rid of your mask just yet. And really you have to think through, if you're around a lot of young people who are not eligible or have not been vaccinated, you really have to think about continuing to wear masks in those settings, just as an extra layer of protection. And that might even be for people who are vaccinated. So I don't want to be Debbie Downer, but let's just speak real facts. If you just even take Illinois alone, we've had millions of people vaccinated in this state, right? 6-7 million people have been vaccinated. And this is one of the most effective vaccines that have ever been produced. But even at 90 to 95% effectiveness, you have to think about a large state, 6 or 7 million people vaccinated, even 5 to 10% of those people, if it's not effective in 5 to 10%, you're still talking about 600,000, 700,000 people who might still catch COVID or get sick. And so even with this super highly effective vaccine, I'm telling you now that there will be fully vaccinated people who will get sick, that will get hospitalized, and even worse. And so unfortunately, there's no neon light that says, I'm one of those people, beware of me, right? So you have to assume that you don't know who that will be. And so having vaccination is the first key step, but masking as well is yet another layer of protection. And so especially if you have kids around who have no protection because they have no vaccination, that might be a good idea. And then also in those larger crowded settings. And then with those kids, you also have to think about what settings you put them into. We know that outdoor is much safer than indoor settings with a lot of people where there might be poor ventilation. You know that if your kids are in a setting where you know all all the other adults are vaccinated. That's a much different setting than if you're in mixed company and have no idea of the vaccination status of people. And then you have to remember if your kid has a higher risk for having a more severe course with COVID. Again, it's not completely predictable. Completely healthy people have had bad courses, but if you have a kid who has asthma or some neurocognitive or neurodevelopmental problem, we know that those kids have had a harder time with COVID as well. So thinking about your own risk tolerance and the risk of the kids might make you want to continue wearing that mask.
Some people feel that they've had COVID and therefore they don't need the vaccine, or it's not necessary to get the vaccine. Is that actually true, or no?
No, and it's a really fair point. You know, in general, you usually think of either having the disease or you get the vaccine. Instead of having the disease, you get the vaccine. In this case, because of how dangerous this virus is, and because there's such a range of illness where some people have had no symptoms, some people have had very mild symptoms, and some people have had severe symptoms. And so because this virus is new, the disease is new, you know, it's hard to know if the people who had the very mild disease, will they have as much protection as someone who had a more symptomatic course? And so this layering effect of where you can get where you would get the vaccination and still wear your mask, you know, having the disease and then still getting the vaccine gives you just that extra layer of protection so that maybe you didn't develop the full antibodies, and now with this vaccine, you have another chance to develop full protection. So again, absolutely is recommended. CDC recommends it, IDPH recommends it. Still get the vaccine even if you've had the illness for that added layer of protection.
So regarding the added layer of protection, do you foresee that a booster shot will be coming up?
Yeah, so we are still looking at the crystal ball, trying to figure out what the future holds. We really don't have the answer to that yet. Again, we are going to be following, you know, what the data shows. So if all of a sudden everybody who's been vaccinated starts coming down with COVID infection, that suggests that maybe immunity is waning, or that maybe there's a new variant out there that doesn't respect the vaccine that we got and can circumvent the immunity afforded by the vaccine. So in either case, that would suggest that there is a need for an intervention. If it's just a matter of we think immunity has waned after 2 years or 3 years or a year and a half, and again, time will show us that. We don't know exactly how long it lasts, but if it looks like, oh, we're seeing this uptick and it's a matter of needing a booster because immunity has waned, then the boosters will happen. If we find out that, oh, actually, this new variant actually is not controlled with this vaccine, then we're going to have our researchers go back into the lab, and it'll just take a couple of, you know, weeks to months to put in like the specific, you know, RNA that's representative for the new variant, and then you'll have a new vaccine that would be, you know, administered. So again, hopefully none of that is necessary. Hopefully this vaccine will protect us against current variants and everything coming for years to come. But again, we don't know, but we'll be following along to see what is necessary, and we are making the plans to prepare if that actuality, you know, comes into play.
Great. Do you foresee that this vaccine become a requirement at any point in time, whether it's for specific professions or in general?
No, I mean, another great question. We have already seen, you know, schools. I have 2 kids in college, and we've already gotten the letters that you are required to get them vaccinated. Not a problem. They've already been vaccinated. I am seeing that there are certain industries that are going to require it for their employees. So private industries can do as they see appropriate, whether it's a specific company or maybe a whole service industry. And so I think there will be some requirements coming down the pike in addition to colleges and universities. It's nothing that we have mandated from the state level, but we, you know, I obviously understand why, you know, a healthcare industry, someone who works with, high-risk seniors, might require that to just give every level of protection for a population that they're trying to serve. So more to come, but nothing at the state level at this point, and we're watching what the different industries and what the different companies are doing on their own accord.
Now, you mentioned universities and colleges. So the next big question is, what is this going to look like for return to school in the fall? I know that previously, this past year, there were some parents that were absolutely not. Unless you can guarantee me that everybody in the building has been vaccinated, I'm not sending my child to school. And there are others that have been on the opposite end of the spectrum of, let's get them back in school, they need to learn. So knowing that the vaccine is not for younger age kids, so therefore elementary school, we don't know, what are we predicting or thinking maybe, or the conversation that school is returning in the fall, how?
So this is one of the very challenging issues. Obviously, just the way you've already outlined it, there's no way that everyone is going to be happy because people are on different parts of the spectrum and everywhere in between. There's so many issues to consider. Whether, what are we going to do about masking? What are we going to do about distancing? What are we going to be doing about testing? The quarantining. So all of these questions we are working right now to answer. I just had a huddle with the team this morning, and we're saying we've got to figure out what the plan is that we're going to propose and start talking to school boards and school superintendents and school administration so that they can start the planning against the fall. We know schools start, in August, so we're nearly not even 2 months out. And so we're putting our plans. We have several drafts that are already circulating now, and we want to share that. We're going to start sharing that with the public so we can get some of the feedback, hear some more of those concerns. But we have to remember how complex this is. Some areas are going to have higher vaccination rates than others. Some schools have more space to be able to do the at least 3 feet of distancing, if not the 6. And some schools, if you put everybody in there, there won't be 3 feet of distance. Some schools have higher rates of kids who are high risk, maybe have some of these neurocognitive difficulties or have some disabilities or asthma. So when you have to put all of that together, those are all the considerations that we'll be putting together. We're still going to have a lot of individual choice in the schools, but we will definitely start laying down some framework so that all the different school districts can start making plans. But, also it's going to be different for schools where people are over 12, obviously high schools where there are people who are eligible to be vaccinated and maybe will have that higher vaccination rate versus schools where, elementary schools where kids are under 12, where there'll be, as of now, like no one vaccinated if there's nothing that comes through over the summer. So all of those things are what we're grappling with. And so we are coming up with the best plans based on the information we have now, understanding very clearly that things are subject to change. We are following what's happening around the world. We're seeing what the new variants are doing in Europe. And unfortunately, we've seen that what happens in Europe, there's a little bit of a time delay, but it usually ends up happening here. So that's why we have to push so hard on continued vaccination, because we do see that our current vaccines are effective against all of the circulating variants. Maybe not 100% or the 95% we're seeing, but even if we're seeing maybe 80, 85%, that's why every single person that's eligible really needs to get vaccinated. And then we'll work through these school things and start sharing that shortly.
We've definitely seen a lot of creativity when it becomes encouraging people to get vaccinated, whether it's $10 off at Meijer or someplace. Someone told me there was a state that was giving away hot dogs and hamburgers. If you got your vaccine, you got a hot dog or a hamburger. We're not going to do that, but maybe it's something to think about at the village picnic. Give away hot dogs and hamburgers for vaccines, but anyway. That was a joke. So, hygiene practices. So what we've seen is you go someplace and everybody doesn't have a mask, and there's really no way of telling if you're vaccinated or non-vaccinated. We can put up signs all day, every day, but that doesn't necessarily mean much. So what precautions should we take, vaccinated or not vaccinated, to try to keep ourselves safe from COVID and beyond? Yeah. Any new health
So
things that have been-
nothing new, more of the same. You have to, when you have no clue, who's in the environment, then that potentially is a riskier situation. If there is no opportunity to distance, ideally you would still like to maintain distance if you can. If you can't, you might consider I might feel more comfortable wearing a mask in this setting. I might try to keep as much distance as I can. You definitely want to be carrying your hand sanitizer and always cleaning your hands. Those are some of the basic things. And then, for the things that you can control, you really can, people are having events where they're saying, the only people that can come to this event are vaccinated people or people who are eligible to be vaccinated. So really trying to have some of those safer spaces where it's safer. And of course, always remembering that outdoor venues are the best. Outdoor, the circulation just naturally makes it harder for you to get a large enough inoculum of the virus with which to get infected. So stay outdoors, especially it's the summertime, 'tis the season, get that vitamin D, be outside.
There's absolutely no shortage of events here in Bolingbrook with
Awesome.
regards to outdoor opportunities. Every week we have 2 or 3 or sometimes even more, so
Nice.
we definitely have that part covered. What communication outlets should the public follow to keep most update information on what's going on COVID-wise or anything actually with regards to the IDPH?
That is really important because there are many, many, many sources of wrong information, misinformation. So if you want some trusted resources, please go to coronavirus.illinois.gov. Please go to the cdc.gov. Almost any question that you would ask can be found at our website, IDPH, or at the CDC website. And a lot of our information is, linked to CDC information. Also, your healthcare system, your doctor, where you get your care, a lot of those health systems have really in-depth, robust websites that answer questions that have lots of information. So go to trusted medical public health websites. That's the best place to get your information. There's so much out there that is wrong and actually gets a ton of attention because it's maybe salacious. I think most recently I heard about how we were all magnetized from being vaccinated and how we have chips in us from being vaccinated. And, I hear so much about that. And so I know that news spreads pretty fast. But if you want the facts, go to cdc.gov, go to coronavirus.illinois.gov, or talk to your doctor, seek out your health system's website.
Definitely a lot of misinformation, which in turn puts fear.
Yeah.
And so, especially the youth. I've noticed that some of our youth 12 and up actually believe some of what they hear. So there is a little bit of a fear factor between the youth. And they're the gullible ones, but they're also the ones that are carriers because they're with everybody doing everything. So
TikTok dances, not distancing.
I think TikTok for the youth and Facebook for the adults, right? Because Facebook is for old people now.
Yep.
I'm told. Are there any questions from any of those attending today in person? Yes, our CIO, James Farrell.
You knew I was going to have that.
Of course.
Well, Doctor, I just want to say I'm a big fan of you and my kids, my daughter especially, is a fan of you. And you're so genuine. And if people can't listen to you and follow your advice, then I don't know who they can get it from. But thank you for coming. But my question is, vaccination, the cards, or you hear that organizations are going to be asking for that vaccine passport. Is there any plans in the future, the near future, to have organizations or companies or bars or whatever asking for passports? Or do we need to hold on to our vaccine passport or our card?
No, that's a great question. So first of all, and thank you so much for your kind comments. There is, the COVID vaccine card that you received when you got the vaccination. You should keep that. I know that can get lost, so we really did encourage everyone, take a picture of it, have it on your phone, email it to yourself, give it to somebody else so that you can always reproduce that. There are, a lot of entities that want to be able to use vaccine as a way to, gain entrance to an event. And so we are looking at ways that we can have that information accessible so that people might be able to use technology to see that, in fact, they are in our registration system, in our immunization registration as fully vaccinated. So I think more to come on that. We don't have all the details on that, but that is an important tool that's going to be necessary for the people who are trying to, who, for whatever the role is, that they need to know people's vaccination status. You know, we're trying to see how they might be able to have the ability to see that if from the state registry. So there is more to come on that, but in the meantime, please use that card, keep a copy of it, keep a picture of it, keep it on your phone so that you can produce that. I know, unfortunately, that there are people who could forge that, but you know, that's what we have thus far until we have a better, you know, electronic solution.
You have a seventh grader who's a fan of yours from John F. Kennedy Middle School. His name is Giovanni, and he says hello.
Oh, hi, Giovanni.
Yes, Ken.
I have a question. Since this all came about, you see spit shields that are in front of counters.
Oh, yeah.
You ever see that going away, or isn't it kind of a good thing to stop flu and anything else?
I know, like, we've learned so much. Like, can you imagine, like, even 3 months from now, can you imagine somebody coming to work coughing and sneezing, and you're saying, oh, good job, you made it in. You didn't take a sick day, you came to work. Like, that's not happening anymore, right? So there are
ideas now, come on.
You know, because I remember I was that kid that got perfect attendance from kindergarten through 12th grade, never missed a day of school. And, you know, so even if you had a little sniffle, like you kept going. That's definitely not gonna flow. That's not gonna work anymore. People are gonna like not even let you in the door if you come in looking ill. So that is something that is clear that if you're sick, you have to stay home. You know, if you know, people are always gonna have hand sanitizer handy, and you think those shields, right? Even if there is flu season, which, you know, we almost eradicated flu season this winter. Usually, you know, flu really affects children, and we usually have flu deaths, and we count those flu deaths. DPH tracks those. We had not one flu death. We didn't even have adults in the ICU. We had 12 total ICU events for adults. So we had no outbreaks of flu. Like, this is unheard of. This is something that annually across the country, 50,000 people die. So it's really like, do you really want to get rid of all of that and be like, come on, flu, have your turn now? Because I don't know, maybe you would want to put masks on during flu season. Maybe you would keep those shields up during flu season, or maybe even outside of flu season. So again, individual businesses will continue to do what they think is best, what is good for their customers, what's good for their staff. It's probably not something that we will have to mandate. But yeah, a lot of stuff to think about. When you know better, you're supposed to do better. So do you just ignore all that and then go back to things the way they were when you know you could prevent ill? It's a great question and something that we all have to think about.
Marty.
I'm going to start by saying thank you so much for all of the updates you did through this whole pandemic. I listened very carefully to a lot of that. My question is, how do we navigate the need to know whether people are vaccinated or not versus HIPAA regulations? And how does that work? I know you're not an attorney, but I'm sure this has come up for you.
Yeah, no. So, I mean, we've, you know, been looking at that. I mean, basically, if you think of it as, let's say you have a work setting, and the work setting says, you know what, the policy for our work here is that everyone wears a mask, period. Everybody's going to wear a mask. We're going to try to be as safe as possible. We're all going to wear a mask. And then the fine print says, if you really don't want to wear a mask and you're vaccinated, then you don't have to wear a mask. If you're vaccinated, then you don't have to wear a mask. So then, if you want to take advantage of the fine print, it's incumbent upon you to voluntarily share that information to take advantage of this benefit that allows you to put your mask away. If you don't want to give up your information, no problem. You're still at the top line. Wear your mask. So it's not really a HIPAA. Nobody's requiring you to share information you don't want to share. But if you want to get down and take advantage of that fine print line, then you can voluntarily share information. But there's no requirement, so there's really no HIPAA violation, because no one is, taking your information and sharing it. You are deciding, I want to share with you this on my own volition because I want to take advantage of this, this benefit.
Matt?
Hi, thanks for coming. One thing I had a question about is obviously we just got the big five. But do you foresee like COVID isn't going away, probably ever, but like when you go to the doctor's office, you have some overlapping symptoms. Me and both my kids have allergies, and my one youngest son got tested 5 times, never had it, but he has those symptoms. Is it gonna be like a time where you can go to the doctor and don't have to have that COVID test? Or is it always gonna be?
That's a really good question. That's a hard one. We had so many situations. No, it wasn't. I was going to say, no, it wasn't Bolingbrook, but I remember so many situations where people, had events or were at work or at school where, it was like, oh, Johnny has diarrhea, and so Johnny was sent to the home. Johnny went to the doctor. The doctor said, this is acute gastroenteritis. Okay, go back. And then symptoms persisted. Now some other symptoms developed. It's like, was there a COVID test done? No, it's acute gastroenteritis. It's a stomach flu. And then finally got tested, and it was, right? Lots of people, that was the common line, like, oh my gosh, it's just allergies, and then found out it was COVID. So I think it's going to be a judgment call going forward. I think maybe because the rapid tests will be so available and hopefully they'll get cheaper and cheaper. You can get it in the stores now and do your own tests. But, as the amount of the virus in the community goes down, then it becomes less likely that it is COVID if there's just not, any circulating disease. Right now we're at the lowest test positivity, case positivity, lowest case rate. It's only 2 per 100,000, 2 cases per 100,000 people right now. The test positivity is 1 point something percent when we've seen double digits, 20% positivity. So it's going to be going forward that it probably won't be every time you get a test, but if you are in a school setting where you have people who are largely unvaccinated, if you're in a community where the vaccination rates are lower, then you'll have to weigh in all those things and decide, is a test necessary or not? But again, those are going to be tough things to work out as we go forward. But I think if we stay on this path with these numbers this low, then you can use some kind of, risk assessment. But I'm telling you, that's not going to be easy trying to figure out, and you'll miss some, right? If you say it's allergies, that one time that it's not allergies, then you're thinking about who you potentially exposed while we thought it was a different diagnosis. So really tough.
Great. Well, thank you again for joining me here today and bringing your guests and helping us navigate through COVID pandemic and beyond. We truly appreciate it. We're honored to have you here. Are there any closing comments that you'd like to make to those watching? We probably have a little over 35 people watching. Wow.
So I just want to thank this community, Mayor Alexander-Basta. I know I met many of your village's leadership when we were at an event at Victory Church. So I saw just the intense collaboration around COVID, from fire and police. And it was just such a wonderful example of what it has taken to get us to this point. And it's just having partners at every level all working together, and you guys are a tremendous example of that. So thank you for your great example. Thank you. I heard about the wonderful project with EMS going door to door, giving vaccinations for those who request it. And so I appreciate you being that torchbearer, that leader, and I look forward to continued partnership, not just with COVID, but for other public health issues that we now have these connections that we can use to make our communities even healthier going forward.
Well, we definitely look forward to working with you for many, many years to come. Thank you all for being here and joining this episode of Community Matters. We will be back in July. We have another great episode coming up on how to save you money, I hope. So we look forward to seeing you. Thank you. Have a great rest of your week and stay safe.